everyone to this important forum, Building Worker Power in Your State During the Coronavirus and Beyond. My name is Patricia Campos Medina. I am the co-director of the Union Leadership Institute here at the ILR School at Cornell University. I will be your moderator today. Please be aware that this session will be recorded. We gather today at a time when the need for connection and community is profoundly needed. As leaders, we face the challenge of responding to the crisis while re-envisioning a new way to build worker power and build power within our organizations and unions. At the Worker Institute, we continue with our commitment to work with all of you in the world of work to advance collective bargaining, worker justice, and income inequality. Despite the crisis, we see this moment as a call to reaffirm our commitment to work together to build worker power in our workplaces. In the eve of May 1st, which is International Workers' Day, we are seeing more and more worker-led actions. Immigrant workers, low-wage workers, workers in our healthcare industries, in the transportation industry are standing up and proudly claiming, "Yo soy esencial," I am essential, which is a call to action that demands that we acknowledge their rightful place in America. To engage in this important dialogue of how we are to respond to this call of action, today we have brought together labor movement leaders, social justice leaders, to share with us their perspectives and what they are doing to respond to the crisis their members face. How are they planning for the future, and what do they think is possible? Our speakers today have courageously risen to the challenge of leading in this time of crisis. And I'm grateful, we are all grateful that they're here with us today. Our agenda is as follows. You will hear from two panel presentations and from our Executive Director, Lara Skinner, who is our closing speaker. After the first panel, we will place you in a break room where you will get an opportunity to talk to each other. We will then take a few questions before we move you to the second part of the program. All instructions will be repeated as we move along. We have a very tight agenda, so let's get started. But before the program starts, let's hear from the Dean of the ILR School of Industrial and Labor Relations, Alex Goldman.
Thank you, Patricia, and welcome everyone to this important discussion we're going to have today. Thanks to everybody who's been working on this, all our friends at the New York State AFL-CIO who are doing this in partnership, hosting this in partnership with us. I particularly want to thank President Mario Salento for joining us today for this as we discuss some incredibly important issues for labor in New York State. As we've all seen over the recent weeks, we have, I think, even more appreciation for the vital role of the workers of New York State in keeping this state going. And we're going to be discussing today some crucial issues around the voice of labor in the path forward. I think of three really key areas that labor's voice is going to be absolutely crucial for the path forward. One obviously is what's going on right now, keeping workers safe as they do the essential work. I think of the healthcare workers, the transportation workers, the grocery store workers, all those on the front lines who are really keeping our society going and keeping it safe. And the toll has already been far too high amongst them. And so it's incredibly important that they be kept safe in the workplace, that they get the PPE they need. And I think we're going to have important discussions around that. But we also need to look forward as well. At some point, we're going to start to be reopening the economy in a very difficult situation. Labor's voice needs to be heard there to ensure that all of us are kept safe as the economy starts to open up. People are going back into workplaces. That has to be done safely, and labor's voice needs to be heard there. And then thirdly, more broadly, our society is going to be grappling with the huge economic impacts of this pandemic. We just saw this morning that another 3.8 million Americans claiming unemployment. We are now at about 30 million have claimed unemployment over the last 6 weeks. That's a catastrophic number for our society. Those are millions of American workers and the unemployment rate is skyrocketing. Labor's voice is vital to be heard in the policy discussions around how we respond to this. And so our discussion today about building worker power during the coronavirus pandemic and in the wake of it is incredibly important. And I want to thank all the participants today and all the speakers for contributing to this webinar. I'm sure we're going to have a great discussion today.
Thank you, Dean Colvin. And to help us open this discussion and set the tone for how we are going to work together as the labor movement, as the worker justice movement, we have an incredible partner for us here at the Worker Institute, Mario Cilento, the president of the New York State AFL-CIO. Mario.
Okay, there we go, right? We're good. All right, so look, first I just want to say thank you to everyone who's responsible for putting this all together. First of all, I hope everyone is well. I hope your families are well and safe. What you're doing today is very important. It's not only important to discuss where we are, but I think it's more important to work together to figure out how we get through this crisis and what is on the other side of this, how we move forward and how we move forward together. So thank you for putting this all together. I have spoken to dozens of labor leaders over the last 6 or 7 weeks, many of whom are on this teleconference today, but throughout this state, from Buffalo to Long Island, and over the last 6 or 7 weeks, leaders of obviously Judy and the nurses, and Stuart and retail workers and construction workers, and so on and so forth. And some of the stories that you hear are just truly excruciating, and I'm sure you're going to hear some today. They're heart-wrenching. But I can tell you that for each of the stories I've heard that are heart and really make you question everything in life, they're also inspiring as well, because it shows how our brothers and sisters are out there on the front lines working to protect us and to feed us and to transport us. So I think that is the motivation for everyone, right? And that's part of the motivation for today of what you're doing, but it motivates us moving forward to get to a place where we're into this new normal, what it means and how we make sure that our workers are protected every day forward for the rest of our lives. The state AFL-CIO has not been waiting. Our staff has been working at least the last 6 or 7 weeks, even before the pause went into effect in the state of New York. We've been working on several initiatives. The most important one is what we are calling Labor's Pandemic Recovery Agenda. That is a state initiative where we've talked about it at our executive board, and we're going to have another meeting shortly. But we've put together and we've crafted a strategy that deals with policy and legislation, what we can do by regulation, a PR campaign put around all of that speaks to rebuilding the economy when we get back from the perspective of working men and women, the most important thing. And the campaign will focus on some of the things that Dean Colvin mentioned, making sure workers are provided with PPE and other equipment and protocols to keep them safe, to have staffing requirements for all industries moving forward, investing in public services and local governments. We need to rebuild our infrastructure for the long-term growth of the economy. And we have to make the case that from this point forward, the wealthiest share the financial burden, because right now, lower income and middle income workers in this state and families are paying the entire price here, socially as well as economically. And we'll never have a better time than now to call for the wealthiest among us to pay their fair share. So the program is underway. The agenda is underway. We continue to update our executive board on that. And I will stop there. I'd ask everyone on this call who wants to be a part of this to please be a part of it. You can get in touch with our staff. You can get in touch with me. And I'll just say, I have no doubt that we'll get through this all together. I have seen the best of who we are as a labor movement over the last 6 or 7 weeks. And we'll continue to show that. And we will get through this together again, as I've said in the past, as a family. We are there for each other. We care about each other. We support one another. We help one another. And we pick each other up when one of us falls down. And right now, yes, we have thousands of our brothers and sisters who are down. But I have no doubt that we will pick them up together collectively and move them forward, keep them safe, and have a better life for all of us. So for all of you on this call, Thank you for putting this together. Please take care of yourselves, take care of your families, take care of your members. Above all, be safe. And I hope that the next time we have a meeting like this, we are all together moving forward. So thank you very much.
Yes, thank you, Mario, for those words and for the reminder that, you know, we are missing each other and the special connection, but this is the best way that we can reaffirm our community and our commitment to each other. Thank you. So let's get started with our panel. Our first panel, I will be moderating the first panel. Each speaker will discuss the challenges they are facing with their unions and their organizations, what the responses have been that they have implemented, and what else do they need, they think needs to happen moving forward. I will introduce all the speakers briefly at the beginning of the panel, and they will all speak in the order that they get introduced, and they have 5 minutes each. I will give each one of them a 1-minute warning before their time is up. This is important for you who are listening. As you listen to each speaker, please write down any questions that you may have in the chat box function that Alison just explained to you at the bottom of your screen, and we will keep track of your questions. And when you return from the group's discussion, we will have time to discuss some of the questions, not all of them, because we want to keep the program moving. So let's get started with the first panel. The first panel is entitled Workers at the Forefront of the Coronavirus Crisis and the Responses. Our speakers today are, first, Judy Sheridan Gonzalez. She's the president of the New York State Nurses Association. She represents 42,000 nurses working today on the front lines of this crisis. Her union is the largest association representing the interests of registered nurses in New York State. Our second speaker is Stuart Applebaum. He's the president of the RWDSU, the Retail and Wholesale Department Stores Union. He representing 61,000 workers in the grocery, distribution, and food processing industry in New York State. RWDSU is affiliated with the UFCW, where Stuart serves as an executive vice president. Our third speaker is Alison Julian. She is a 2019 graduate of the Union Leadership Institute and a founding member and organizer for the National Domestic Workers Alliance. NWA represents 250,000 nannies, house cleaners, home care workers across New York State and the United States. Our last speaker is John Samuelson. He's also a graduate of the National Labor Leadership Institute and the national president of the Transportation Workers Union. Prior to being the international president, he was the president of Local 100, one of our great partner unions here at the ULI. Local 100 represents 41,000 workers in New York State public transportation system. And TWU represents 150,000 transportation workers in the United States. And they are all essential workers. So let's get started. Judy? Judy, please unmute.
I know, it's still learning.
Thank you.
My thanks to the Institute for putting this together and bringing all these amazing labor leaders together, and for all the participants as well. This is very important. One of the good things about this crisis is that we all communicate more frequently now without having to go back and forth to meetings. With all the Zoom calls, it's really been very good for us to communicate. But of course, the crisis has been awful for all the frontline workers who are at risk. In healthcare, we started off behind the 8 ball with the draconian cuts we faced from the federal government and the state government, starting out at a very bare bones level to make us completely incapable of handling any kind of a crisis at all. And with the kind of neoliberal approach in this country right now of, lean management and all the kinds of situations with us dealing with austerity and shaving off the workforce, particularly in healthcare, we were incapable of handling anything more than business as usual, and business as usual was very difficult. with patients being crammed together in the emergency rooms and crammed upstairs as well, particularly in our poor communities. I work in the Bronx, which is number 62 in health indices in the state. So my community in Corona and Queens and Brooklyn, all the areas that had the worst health outcomes were the most hit by this virus. When it started, we were also betrayed by the Centers for Disease Control, who had, all the scientific agencies that we had faith in became politicized in the process. On the federal government and the state government, Department of Health in the state, on the federal government, the CDC, National Institutes of Health, instead of having guidelines that were really protective for workers, it was also an austerity program. There was supposedly this scarcity of everything. And instead of saying, well, we have scarcity, let's do what we can, they loosened the guidelines, which put us all at risk, which is why we had so many deaths and injuries and illness among our workers. So the big challenge for us initially in healthcare was fighting for the PPE, the protective equipment. And everything was a fight, getting masks initially, getting these N95 masks that protected us from airborne viruses, getting shields, getting gowns, getting the equipment that we needed to protect ourselves, and also the incredible influx of patients that we had, very sick patients that we had, without the capacity to even take care of them. Our staffing was already bad, and then people being just tossed into areas that they had no idea how to manage. It really shows the fallacy of any kind of concept of labor management cooperation that the employers have been promoting, but which they did not implement. In the very beginning, our union met with all the managers and all the CEOs of our hospitals or wherever we could to say, let's work together. Obviously, this is the time for partnership. We've got to figure out what we're going to do when this pandemic hits. They didn't take it seriously, or they didn't take us seriously. And then instead of, we've had 6 weeks that feel like 6 years, 6 weeks to be able to train and redeploy and do things in a way that caused the least disruption possible. And instead, everybody's disrupted. So what did we do? We had to organize. We had to organize without being able to be out in the streets, except we kind of did go out in the streets a couple of times. But we had to organize by doing all kinds of electronic communication, organizing that way, dealing with the media, and actually getting outside with social distancing to protest with the conditions.
1 minute left.
Okay. So what has happened is that it's empowered the workers. We have a structure that we've set up with many Zoom calls among our members. So that communication, we have a synergy. We have a synergy with communication. We've communicated with other labor leaders. We've communicated with community, and we've recognized that all together we've got to do something to change the healthcare system. Its for-profit nature was anathema to anything that had to do with the public good. We need a national health system. And we see this as a moment for labor and community to come together. And as Mario said, tax the rich, support us so that we don't have to choose between dying and working, between getting sick and paying our rent, between taking care of our children and forfeiting our own lives. So that solidarity is really powerful, and we hope to move forward on that level.
Thank you, Judy. Right on time. So, right on time. So thank you very much. Our next speaker.
Hi, good afternoon, everyone. I'm Stuart Applebaum, and I hope everyone is staying safe and staying well. And I, too, am really delighted to be part of this program today. And I think Cornell does amazing things, and this is just another one of them. My union represents people in a lot of different occupations and in many places around the country. We are putting a lot of our attention right now in the Southeast, where we represent tens of thousands of people who work in poultry processing plants. And the conditions there are horrible, and people are dying. And in New York, we tend to represent more retail. A lot of our members are not working at all right now. Retail has been basically shut down. Department stores, other retail shops are closed, and our members are worried about what the future is going to portend for them. But we also represent people who are deemed essential, who are working. And that includes supermarket workers and people who work in drugstores. And they're worried. They're worried about getting to work. They're worried about being at work. They're worried about what they're going to be bringing home to their families when they go home. When you work in a supermarket, you're dealing with thousands of people who may come into a single supermarket in one day. And you're going to be exposed to all sorts of things if proper protections are not taken. And at first, proper protections were not being taken. PPE was difficult to come by. There was no social distancing. The customers created problems, and people were getting sick, and people have died. People working in supermarkets have died. As a result, the first thing we did was to insist on stronger safety protections for all our members. And sometimes what we had to do was to shame employers publicly, and sometimes we had to go to government officials and ask them to intervene. We insisted on barriers, we insisted on PPE, and we insisted that more be done. And we also called on customers to do their part. And so we publicly called on having requirements that customers wear masks when they go into supermarkets. And we were pleased that within 24 hours, Mayor de Blasio, and shortly thereafter, Governor Cuomo agreed with us and issued that requirement. And we also insisted that our members who were also worrying about what was going to happen to their children while they were working and were essential workers would be eligible to have some sort of child care. At first, they didn't get that, but then we lobbied and we were able to secure that for them. And we've also done a public relations campaign on how customers need to act when they're within our stores. I want to say, though, that I think attitudes about these essential workers are changing. People who overlook the jobs that were done by supermarket workers or distribution center workers now understand the dignity and value of that work. And I think that gives us opportunity for after we get to the other side of this pandemic. We have the opportunity to organize in ways we haven't done before. We have more people from non-union facilities reaching out to us than it's ever happened before because they know their employer does not necessarily have their best interests at heart unless they come together with a collective voice. We have new ways of organizing, as we're doing with this call. And we're going to get and seek public support and public policy changes under Mario's leadership to advance the ability to organize. I have to just leave you with two final thoughts. One is we also represent car wash workers who have additional problems because of their documentation status. If you want to help us with their funds, go to our website. And some employers like Macy's are trying to take advantage of the situation, and we're standing up to them. Thank you all.
Thank you, Stuart, for that. We'll have an opportunity to ask you questions afterwards and talk. So I want to try to move the program along. Just a reminder to all of you that if you have a question or something that you want to ask any of the speakers, to please write it down on the chat box, and we will come back to it after we return from the group discussions. Our next speaker, Allison.
Greetings, everyone, and thank you so much for having me here to share with all of you. And it's really good to be on a call with all of you to see that you're all doing well and healthy. That means a lot in this current moment. So it's really an honor to be here with you. So my name is Allison Julian. I'm with the National Domestic Workers Alliance. We are the leading organization for domestic workers across the country. Like Patricia shared, there are millions of domestic workers across the country. And here in New York State, there are over 250,000 domestic workers. And that's the base of domestic workers that we are organizing here. When we talk about domestic workers, we're talking about nannies, care providers to the elderly and disabled, and house cleaners. These are, I oftentimes say, America's best kept secret, because they're the invisible workers that work in other people's homes. So oftentimes there's no protection or very little protection for these domestic workers. What we're seeing at this moment is that we've known this from the beginning of time, that domestic workers were always frontline workers. They're the ones that hold down many families so employers can go to work. And they oftentimes don't get the recognition, respect, or pay that is deserving to them. And in this moment in particular, we see how that has shown up for domestic workers here in New York, but across the country. They are at the front lines of this pandemic. They are the ones who are being tasked with risking their lives in many ways in comparison for a paycheck, or those are the situations that workers are currently finagling. Domestic workers are mainly low-income immigrant women of color. Most of them are heads of households. So they're the ones that's holding down their home families and their families in their workplace. So they are tasked doubly with the need to show up and be their best selves. And in this pandemic, that's really hard to ask for from this community who lack the infrastructure of proper health care. Many of these women come from low-income communities where there are lack of resources for health care, where they're cramped on subways every single day, traveling back and forth to work. And even though they may be working for wealthy families, they have to return to their communities where they live. And what we're seeing from as early as the second week in March, what we had been seeing was that domestic workers were being sent home, being terminated, being furloughed. These are all some of the languages that they were sharing, that employers were sharing with us. And we knew from the moment the first case got to New York that was reported, we knew our workers would have been impacted. So as an organization, we immediately went into rapid response mode, answering the concerns and the questions of the workers who oftentimes will not qualify for any of the stimulus packages. They will not qualify for unemployment. So there's so much that domestic workers are left out, literally left out in the cold. And these are the workers that are providing care. And the question that I have, and I know we have as an organization, is who now cares for the people who've cared for us for generations? And I myself am a former domestic worker, and seeing what my sisters are going through, it's heartbreaking.
1 minute
To
left.
say the least. So what we're doing as the National Domestic Workers Alliance, we came up with a cash assistance to help provide domestic workers with resources to help them through this time, because it's important that domestic workers can have that space where they can stay at home and be safe. Because what we're also seeing is so many, like many of you, there's so many loss of lives for domestic workers in this industry. And it's important that we have forums like this that we can share about what's happening within the domestic worker sector. And to learn more about us, I would say check us out at domesticworkers.org to find out more about the work that we're doing within our community.
Thank you, Allison. Right on time. Just a quick reminder to please write your questions on the chat box. And John, you're next.
Hi, good afternoon, everybody. I'm John Samuelson. I'm the International President of the Transport Workers Union, representing not only workers in the New York City transit system, but transit workers and airline workers and railroad workers across New York State and across the country. So as of this morning, unfortunately, we've crossed the 100 threshold and now have 101 fatalities nationally, including 80 in New York. And as the other panelists have noted, and by the way, I just want to thank the other panelists for all the work, the hard work that the members do that you represent, because it's invaluable to transit workers and on a very personal level, invaluable to my family. I don't know where we would be without aides taking care of my mother and grocery store workers bringing food on the table for us, and of course the nurses. So transit workers obviously are on the front lines of this, and as with every other work group, we've had to fight tooth and nail, not only in New York, but across the country for every single thing we've had, beginning as was noted before with the recommendations of the CDC, that PPE not even be worn in the subway and bus system in New York. That was the first fight we had, and we steamrolled the MTA, began providing our own PPE, and compelled the MTA to stop providing it. But the damage was already done. The New York City transit system, unfortunately, is one of the most diabolically designed spreaders of the virus one could imagine, and the toll has been taken. So we continue to fight. We came very close in Philadelphia we set a strike deadline actually, and the mayor of Philadelphia intervened and stopped the strike. We came very close to strike action in Jersey City. And just New York, Philadelphia, Jersey City, 3 different states is an indicator as to what part of the problem is for transit workers and transport workers in general. There are state-by-state guidelines and transit systems that make us, that have put us in a spot where we have to fight this battle out city by city, municipality by municipality on the transit side. So we've been calling on the FAA, the FTA, and the FRA to institute uniform federal standards. It's a big part of the fight that we're in right now. Uniform federal standards would stop us from having to get into this gutter fight in every single city and every single transit system across the country to have standards enforced, to have common sense public health standards, worker protection standards in place. We're not there yet, and transit workers continue to die. The federal government's kind of relaxed about this. They don't want to put enforceable measures in place. And for the life of me, they must see that transit workers and transport sector workers are dying every day, yet they fail to act. So just in general, COVID-19 it's a fight the likes of which we've never seen before. We've had Hurricane Sandy, we've had the World Trade Center attacks, we've had fights with specific companies or specific industries, but we've never been in a fight across the board in every city, every local union that we represent. The fight is in every state house, every city hall. It's in Washington, D.C. And this is now, it's testing the capacities that we've developed. It's testing our ability to fight back. And without the fight back that we have in place, the death toll would be in the hundreds. It wouldn't be 100. So in fact, it might even be in the thousands. And the fight goes on. Right now, currently, we're in a huge fight in Miami. I don't know if anybody's following the media, but it's a pretty ridiculous concept that this far into COVID-19, transit workers, transport workers, grocery store workers, any workers would be in a battle about fundamental ideas like personal protective equipment to protect workers. It shouldn't be. And I think we need to learn the lessons. We need to be prepared for the next time. And I think the biggest the biggest takeaway for me is that city by city where, city by city, where workers have organized together and collectively fought back, taken industrial action directly at the bosses, that's where we've had success. That's where we've made gains. And in New York in particular, where union density is still 25% or hovering around there, we have problems. Imagine what the problems are elsewhere throughout the country where union density falls way behind where we're at in New York. So I don't know how much time I have left, but I'll pay homage to Joe Biden and say you can take the time back, and I'm here
30 seconds. 30 seconds.
Fight back, we win. We don't fight, we lose.
Yeah, great. Thank you. Thank you, everybody. All the speakers were great at being on time, and we will have an opportunity to interact with them once we come back from our breakout room. So thank you for those inspired remarks and for letting us know all the hard work that you're doing. So now to turn us into a breakout room, I'm going to turn it over to Allison, but let me give you the instructions of what you will be doing there. You will have 15 minutes in the breakout room, and there will be about 4 other people with you. There will be no facilitation on the breakout room, so please make sure that everybody gets to say something and share. And then when we come back, we will engage in discussion, like I said, with the speakers. In your small group, quickly introduce yourself and begin a discussion around the same areas of discussion that the speakers share. What are the challenges that you are facing in your union or your organization? And what are the responses that you have implemented so far? you will get a notice when you have 2 minutes left in your group, and you will be sent directly back to the main room after 15 minutes. So Allison, please, you can turn everybody into the breakout sessions, and I hope we have a productive discussion, and I'll see you back in 15 minutes.
Pretty awesome technology.
Sherry. Helen S. Jarrett.
How you doing, Helen?
Best class
Hey,
of
y'all.
2018.
Nice to see you.
Helen.
Jared, I can't.
Hi, Helen.
I saw hi, Nina. How are you?
Hey, y'all. So good to
I
see
need to
you
know, y'all know
all.
how many 2019 is on here? Best class ever. We know who really the best
Whoa,
class.
whoa, whoa, whoa.
Yeah.
Mute them all. Mute them all.
Oh.
Hi, Lucia.
I'm sorry.
Yeah.
What's going on, Mario?
As we can see, the Yuli is in the house.
Yeah, hi,
So thank you for taking the time. Are we all back, Allison? Is everybody back?
Yep, we're all back.
Okay. Well, welcome back, everyone. I see so many friendly faces. I want to give you a hug, all of you. I hope that you got to connect and have some more in-depth discussion in your small groups. And now we are going to get an opportunity to engage with the panelists again. And some of you did post some questions, so I'm going to ask them to them directly. And we will, we'll try to close up this part of the session. So the first question goes for the panelists. And the first one is, how do you organize actions to fight back for your members, considering physical distancing? So perhaps you can start with you, Judy, and then we go from the panelists, and you can share some of the tactics or some of the strategies that you're using.
Well, one thing we found, we found out the technology before we decided to actually go out in the streets, and I'll talk about that in a minute. We found out that there's a technology where we could have members sign a petition, but instead of it going to some sort of central petition, immediately several emails would be sent to the chief officers of the hospital. So if you get 500 people to sign a petition, you're sending out 1,500 emails, and everybody's email box gets completely overloaded with the same statement. Or we would have people organize and send their own words about what was going on, because we were getting these horror stories, and it was just breaking my heart. And I said, well, I started forwarding them to the bosses, and I said, send them to the bosses and copy the union. And people were telling their stories, and the boss's response was, I see you're organizing for people to tell us things. I'm like, no, we're telling people to tell you what they're going through, so that when you're doing what you're doing, it's a problem. The other thing that we did was, when we realized that we had to get even more publicity, we held press conferences. Sometimes they were just press conferences at a distance, but then we figured out this social distancing strategy with either ropes or pastels on the ground or whatever to keep people apart, as we had a press conference where we would speak on behalf of the patients and the staff and the community. And those were very successful in getting attention. And we put our concerns out there. The combination of media, social distancing rallies, and Zoom, and all the electronic stuff that we could use to harass the employer into moving forward. And finally, I guess the lawsuit got a lot of publicity, and the employer had to respond to that as well.
Anybody else from the speakers wants to share? And
I think, am I supposed to hit a button or something? So I think the organizing in the transport sector, in the age of social distancing, that all the fighting that we've done is to create social distancing. So we didn't have it to begin with. In the transport sector, all of these battles are over social distancing, whether it be to decrease or decompress density in the transit systems or in the airlines, or to decompress density in the workplace. So we've we've done these multi-legged campaigns, a political campaign combined with a media campaign, combined with direct industrial action in the workplace to create the social distancing that you're talking about and create other productive work rules and protective work rules. So and that fight continues with us.
Yeah.
I would say much of the same about technology. We continue to organize. We have an organizing campaign against Housing Works, about 600 people there. And what we're doing is we're meeting this way, the way we are today. We stay in even closer contact because we're forced to. And for a lot of our members now, we're doing town halls. We do weekly town halls, and we have engagement from a lot of our workers in different industries, more so than they were engaged before. So we're keeping it, we're still able to organize, we're still able to meet, we just do it a different way.
Yeah. Allison?
I always have to remember there are two of us. So
Okay.
for us, we're using the online platforms like most of you have shared to really bring workers together through webinars, using Facebook. So online, now we are doing most of our organizing work online. And we're seeing this as a way that workers are coming together. We're getting new workers to become involved and become dues-paying members of the National Domestic Workers Alliance. So as an organizer, there's always time to organize, and this moment, it presents those conditions for us to continue organizing and bringing communities together.
I want to ask one more question of the panelists, and it's related to PPE. There was a comment that just came through here that basically said, given the concerns that we have with PPE for frontline workers, and all the actions that have happened to not to correct the situation, at what point, number one, what is the state of PPE for health and safety health workers and other safety concerns for other workers in their workplace? And at what point, if workplaces are not providing PPE, at what point do we have a duty to perhaps not tell workers to go to work? That's the question that came at the end. But the question is, what is the current state of PPE for healthcare workers in the other industries?
Do you want to go back in the same order?
Yes.
So it's inconsistent in healthcare. In the nursing homes, it's really bad. Certainly in non-union places, it's awful. Those of us who are unionized, every fight we've had has been for better PPE, but we're not anywhere near where we need to be. We really need this different kind of, talking about N95s, we need something called an elastomeric. Picture of that. Where is that? That's what this looks like. Looks like a gas mask. It's something that we can use. It's probably cost effective. It's, I don't know if you've seen the pictures of nurses' faces, the scarring. Has any,
Yeah.
We have permanent facial scars now from wearing, N95s are designed to be worn for one patient. People are wearing them for 12 and 16 hours and they're just having terrible reactions, but also it's not as protective as these other pieces of equipment that we should be having. The issue also about fighting back, everyone else can strike. If we strike, people are going to die. When we do our strikes in health care, you have to have a 10-day notice. And of course, everybody's not coming to the hospital on death's door. People wanted to walk out. People wanted to say, well, I'm not going to work if I don't get that. But you can't do that because people would die. So we were really in a very difficult situation in terms of doing some kind of a job action where we would withhold our labor in any way, because the immediate impact would be death. So that was really hard because the nurses had the spirit, like, let's do that, but we can't. So we're not where we need to be. That was also part of the nature of the lawsuit, but we've definitely gotten better than where we were. But many, many places are, they'll make an agreement. The high level will make an agreement, but on the ground, people are being bullied and intimidated out of enforcing the agreement. So like I think Stuart was saying, we've set up these multiple layers of communication for workers, town halls in a unit, town halls in a region, town halls in a discipline, town halls everywhere, back and forth, up and down, vertical, horizontal communication, so that people can be armed with not only what the rules are, but how to fight for them on an individual level, collectively in a shop floor, collectively in a facility, and collectively as a union. Multiple layers of fight back, and people are very engaged in it.
Okay. We'll take one more response from the panelists on this discussion, and then I'll ask one last question. So, you know, I don't know who else wants to.
I will. I'll say in supermarkets now we have adequate supplies, but part of the reason for that is because the union went out and found the equipment.
That's right.
And got it to the employers who didn't know what to do or where to go. And I think you're seeing a big difference, which we haven't highlighted here, between union and non-union employers. And it's the union employers where you get the equipment, and people early on were protected.
Thank you. One last question, and then perhaps we can hear from the other two panels before we close this panel. How do you see this crisis as an opportunity to build power? The fact that we're still fighting for PPE, the fact that workplaces where we're taking care of our loved ones are still in such more crisis. How is this an opportunity to build worker power, which is the topic of this panel or this forum today?
I think now more than ever, we have to recognize that all of us are in this crisis together. And if we were thinking that we were individuals before, this moment is calling on all of us to come together. As a leader in the domestic worker movement, I would love for us to be doing more work with many of you and the unions that you're working with, because we're all impacted by this. And that's the messaging that we're also sharing with domestic workers. We can no longer be in isolation, because this moment is calling on all of us. And we know the conditions before COVID-19 wasn't serving us. The systems were broken. And this moment is really just shining a light that all of us can see what those systems are and how do we collectively come together to advocate for those changes that we need across the board, from healthcare to wages to health and safety in the workplace. These are all issues that impact all of us as a community.
John, any closing thoughts?
Yeah, just in terms of building worker power and opportunities, a couple of things on that which are really important. And we're not in the situation that the nurses are in, and I'm thankful for that. And we've only achieved a level of safety that we have right now by work refusals, and we have a standing order out to our members across all industries to refuse to work unsafely, whether that's as a track gang or on the ramp at JFK or Dallas-Fort Worth. So I think in terms of building worker power, this has brought with great clarity, a sense amongst our members that if they stand together collectively and fight back, that they can win fights against bosses that they didn't think they could win before. And it's kind of life or death now. If we don't fight, another TW member will die. And then on the other worker power element of all of this is, I believe, and it's playing itself out right now, that there'll be a massive organizing boom, particularly in the transport sector, in the aftermath of this crisis. It's going on right now. We've been contacted by work groups across the airline industry. This whole disparity between union and non-union we see it, but workers themselves see it. Workers that are unionized, that are working next door or in a town or city next door where workers aren't unionized, the level of treatment that unionized workers have and the level of safety they have relative to their non-union counterparts is stark, and it's startling. And that unto itself is gonna create this boom. And we're fielding phone calls right now and trying to line up when we can begin organizing. And not only when we can begin physically organizing, we're doing all of the electronic elements of an organizing drive that we can while we're in isolation. So we'll come. There is a cold comfort kind of silver lining to all of this.
Yes, thank you. And that's the hope and the challenge, that we can rise to the occasion of responding to the workers' demands for unions and organizations to help them build power. So thank you for those closing remarks. We are going to move on we're gonna close this part of the session, and we are going to engage in the second part of this discussion, which is about policies that we are pursuing. So for that discussion, I'm going to turn it over to Kim Cook, a faculty here at the Worker Institute. So Kim, thank you everybody so much, and applause to the speakers. You can do your speaker hands here. Yeah. Okay, thank you. Kim, all yours.
All right, thanks, Patricia, and thanks, John, for the segue to a conversation about organizing and policy work that we're doing. And I'm thrilled to get to introduce our next panel of labor leaders. I think most of us are pretty familiar with the federal stimulus package and what's in it for workers, like expanded unemployment benefits, especially for gig workers, paid sick leave for COVID-19, and a few other things, some of which none of us would have believed possible even a few months ago. But we also know that it's not enough. They're not, they're not long-term. There's a huge gap, as Allison and others have mentioned already, and the challenging implementation of these programs is left locally. So we've asked our next panel to dig in on the policy solutions that they're focused on at the state and local level. And we want to hear more about some of the inspiring organizing that's going on to build worker power in the midst of this pandemic. So the panelists for this next group are in this order. Lucia Gomez, also a Union Leadership Institute graduate. I don't remember which year, Lucia. Political director of the New York City Central Labor Council. She's going to talk about local efforts here in the city. Then we'll hear from Joe Canavas, who's special counsel at the New York State AFL-CIO with a statewide perspective. I know a few of you asked about policy questions for the last panel. You'll get a chance to talk to Lucia and Joe about that now. We'll then hear from Abdullah Yunus. He's the Director of Political Engagement at the New York Immigration Coalition on policies specific to immigrant communities. And then finally from Dave Hancock, the Director of Worker Stand Up, the Warehouse Worker Campaign of Workers United. Each panelist will once again have only 5 minutes to update us on their work, and I'm going to give you each a 1-minute warning. And then after that, we'll actually take questions from participants. So once again, please write your questions as you think of them in the chat room. So we're going to start with you, Lucia. Welcome. And I know you have a screen share you want to?
No, I think we're good. Seeing the previous panel, I think we're fine if I just.
Okay. All right, great. Thanks. Welcome.
Well, thank you. Thank you so much for having me. And this is wonderful. I love engaging with video calls. I love Zoom, 46 days later, and I'm finally loving it. I was one of those who just put my picture up and I started getting creative with that. But, I would say that, around this time, I've already taken in Andrew Cuomo and his daily briefings. I would have already tried to not listen to de Blasio and his daily briefings. And as the political director of the Central Labor Council, I have to take all these things in and then, kind of put them through my lens of understanding what my workers that are under those public servants' charge are actually going through and knowing what those things are. It's really frustrating on our end, but some of the things that we're looking at the city level and some of the solutions that have been presented without labor input, really. We always have great public servants that do great public good and that are supposedly really great for labor and workers. Yet we are seeing that there's this proposed Essential Workers Bill of Rights at the city level that was proposed last Thursday. And we're seeing things like, paid sick being expanded to gig workers. We're seeing, premium pay, $30 for 4 hours, $60 if you work more than 6 hours, and then $75 for if you work 8 hours days. And so we're really curious and interested in seeing how that actually plays out. If it does pass, right? How many employers would actually choose to keep 10 people on the floor at a Duane Reade versus cutting back to 3 people and maybe, outside pickup versus having folks actually be in-house. We're looking at how this is going to impact supermarkets, right? And whether or not that will get more of our members laid off, whether, or if in fact, businesses will shut down. This is for over 100 employees. It's impacting the, the medium size companies, if you want to call 100 employees medium-sized. But there are pieces of legislation that are being proposed at the council level in a time when these are pretty big, heavy changes that have been proposed at a national level by, Senator Warren and a few others. And, it's really interesting to see that come to New York City in a way that we still haven't had enough time. Everything is, what used to be, 3 weeks before we even saw a piece of legislation see the light of day, things are happening in like 24 hours and 36 hours, and you need a response and you need a quote. And we're seeing more requests for quotes than we've ever had in 36 hours. And we're pretty much running the city based on, spokespeople and quotes and tweets being put out, whether it's the mayor, whether it's, mayor wannabes in 2021. And so stripping away all the politics and the political intentions of everyone that's running and proposing all these pieces, as labor, we need to, be able to understand, well, what's the best course of action going forward for our city, New York City workers. What is the ways in which we need to fix, obviously, the way in which workers are being paid during this pandemic, but is that to be negotiated through legislation, or is there a bigger push to negotiate these things through contract, or is it the state that should step in, or is it the federal government that should be considering hazardous pay and some kind of supplement? And so all these conversations are having, while at the same time we will vote and have an opportunity to everyone vote mail-in ballots, right? So June 23rd is our upcoming primary. And then we have
Lucia.
Biggest election of the year in 2020 in November. And so, I think the biggest challenge for our unions right now is trying to even grasp legislation that will positively impact our members in the future versus what would positively impact their membership right now, what's feasible, and how to include all workers that are not being, addressed during this pandemic. And so, we're looking at all the city council pieces of legislation, especially including gig workers and the classification and their attempt at a city level to do what the state has not been able to do on the ABC test. And so we're curious as to, where this is going, but we're making sure to keep our affiliates abreast and trying to add value to their existing operations and those that they've had to, make smaller as a result of all things taking place. So that's my.
Great. That's awesome, Lucia. Thank you so much. Joe, you're up next.
Thanks, Kim. One, thank you for inviting me to participate. This is an important meeting, and I appreciate having the opportunity to share with you a little bit about what the New York State AFL-CIO is doing. So the state Fed, I imagine many of you know, is a labor federation representing about 3,000 unions across the state. Those unions in turn represent approximately 2.5 million members. And we represent people who work in the public sector, the private sector, and the building trades. Since this started, we have been advocating on behalf of workers from a almost nonstop, from a health, safety and health perspective, and then two, when it comes to receiving prompt access to unemployment insurance, and then also workers' compensation for the workers who do get sick on the job. In addition to that, we're looking forward and participating in the dialogue around what the reopening looks like. And from our perspective, really worker safety has to be a priority here. We have to ensure that one, our workers never suffer again because the state is ill prepared, and there are a couple of facets to that. In addition to that, we have an opportunity here to expand and enhance basic labor protections for all working people. We talked in the breakout session a little bit about specifically the benefits and the programs that undocumented workers don't currently have access to. Fortunately, the workers' compensation is not one of those, but certainly we're looking at that. We're looking at investment in public services and those workers who provide them. rebuilding infrastructure and economy with union labor. We've seen a lot of proposals out there when it comes to infrastructure investment and spending money to jumpstart the economy. But we have to make sure that those people who are performing that work are earning good middle-class wages. Creating good jobs and generating revenue, but also, as Mario mentioned earlier, we have to make sure that the wealthiest among us shoulder their fair share of the cost here. All of the sacrifice so far has been made by working people, and not enough has been made by the people who can truly afford it. I want to just take a moment to talk about workers' compensation, because it's something that I spend a lot of time working on. In New York State, if you are exposed to COVID-19 in the workplace, you are entitled to workers' compensation. So workers' compensation benefits provide wage replacement. Right now, the cap is $934 a week. It pays for your medical. That's particularly important for union members and unions. The workers' comp carrier should be paying for your members if they need healthcare because they contracted COVID-19 at work, not your union negotiated healthcare plans. In addition to wage replacement and medical care, unfortunately for those who pass, there is a survivor benefit. The survivor benefit is that $934 a month, or capped at $934 per week. I apologize. For surviving spouses who don't get remarried, surviving spouse can receive that for the rest of their life. If there's no surviving spouse, a minor child or child up to 23 can receive that benefit as long as they're in school up to 23.
Joe, you have 1 minute.
If there's no surviving spouse or minor child, a true dependent, and maybe a developmentally disabled sibling or a developmentally disabled adult child can receive that benefit. If there's nobody able to receive that benefit, instead it would be a $50,000 payment to the worker's estate. On top of that, there's a funeral benefit of up to $10,500 depending on where you live in the state. We're doing everything that we can to get workers to file. The carriers are going to controvert, and they're going to seek to have workers prove the specific individual patient or customer that they contracted it from. We're working at the Workers' Compensation Board to get them to acknowledge a presumption. They have the authority to do that. There is a litigation route that's being considered. And then finally, if we need legislation to compel them to acknowledge that presumption, we will pursue that. But
All right.
for all of you, I ask you, please have your members file. If you have any questions, please contact me offline. This is vitally important to make sure that these workers and their families are protected.
Thanks, Joe. You know your workers' comp, clearly. Thank you. So let's move on to Abdullah. Abdullah, welcome.
Thank you, everyone, for attending, and thank you for hosting us. I also want to thank all the speakers before me. And before I begin, I actually want to just lift up something that Allison said earlier. Now more than ever is a time for us to realize that we're all in this together, and this crisis is like laying that bare for us here, very specifically in the immigration community as well. So I'm with the New York Immigration Coalition. We are an organization of about 200 member organization across New York State. Many of those organizations are also based in New York City. And, the spectrum of work that these organizations are engaged in goes from labor all the way to providing direct services. And that's been the advocacy space that we've been in. And the context that we've been organizing in right now is austerity, austerity, austerity. And while there traditionally hasn't ever been that much money for immigrant communities in New York, we just came out of a state budget that was extremely bare bones, and now we're looking at an additional $10 billion cut in this budget as well. Coming up, specifically, $8 billion of that is going to be in the aid to localities bill, and that's an area where many of our organizations are able to get funding to actually do the services for our impacted communities. And now we're in a New York City budget where they already received a $8 billion cut in funding from the state budget, and are also, that translates to about a 9% cut in their budget. And that's something that's been on our minds. And this is all couched in a federal context where there has been really no relief for undocumented people and undocumented workers, spouses of people that don't have status, or people in mixed status families in general. That has been something that we have really reoriented our work around to very specifically focus on. What we have been fighting for is a federal stimulus package that will actually provide relief for people in mixed status households and all people in the United States that file their taxes. Because, at this point, it's food, shelter, you have very material needs that aren't being met by people, by the state for people right now. We also, on the federal level, want to automatically extend work authorization for the length of time that the individual previously held status, because you have DACA and TPS recipients that are in a very precarious situation right now. So we've been trying to really push for something like that to be included in the relief packages. And we want to make sure that testing Medicaid relief is accessible to everybody, regardless of status in this moment. In terms of particular organizing strategies that we've been doing, because the challenges we face are no face-to-face meetings, no rallies, no direct actions, a lot of hearings have been suspended. All the traditional pathways for advocacy have pretty much been shelved. We've been reorienting around digital organizing strategies like many of you all have. So we've been putting together lobby days for our members to be able to really, get in front of the elected officials that are going to be in a position to make these decisions. We've been using phone to action tools as like to great effect by getting emails, phone calls, text messages out there and clogging up people's inboxes to get their attention. That's been very effective. And another way that we've been organizing is many of our face-to-face events that we used to do, for instance, large events based in communities where we can have people interact with their elected officials, get access to services regardless of status. We've shifted those to Facebook Live, to Zoom, and that's been very effective, but still it's a struggle to actually deliver the services that people need. And, just the big picture here is that we have 50% of the workers, 54% of the workers that are frontline workers are immigrants right now. We have 34% of the deaths that have been due to coronavirus in New York have been in the Latinx community. You have 1 out of 6 people that in New York that have lost their jobs are undocumented. And we continue to be in a time of austerity. So we're really looking for putting pressure on Senate Democrats on the federal level and to really start looking at revenue raisers on the state level to start being able to really advocate for the work that we're trying to do.
That's awesome. Thank you so much. Appreciate that. And Dave from Workers United.
Hi, everybody. Thanks for having me. Thanks for inviting me to participate. Thank you to all the speakers before. There's just some amazing leaders engaged in some really inspiring and terrifying life and death struggles, literally. And I'm just learned a lot. And thanks for everybody who's been participating beyond that. We've got a huge number of people still on this call. My name's Dave Hancock. I'm the Warehouse Campaign Director for the Laundry Distribution and Food Service Joint Board. We're an affiliate of Workers United and SEIU. We represent 8,500 workers that work in warehouses, industrial laundries, public sector occupations, all essential workers in the 5 boroughs, New York metropolitan area, New Jersey, and Connecticut. And we have a campaign called Warehouse Workers Stand Up to raise standards for all warehouse workers in the region. and it's a broad-based coalition. But we're in an insane time, as everybody has talked about. In the last 6 weeks, we have been inundated with calls and emails and Facebook messages from non-union warehouse workers. Many times over the number of workers that have reached out to us over the previous 12 to 14 months. Workers, as everybody know, in non-union warehouses and other essential occupations, they're on the front lines with no protections. Workers are terrified, and it's, as much as this is a challenge for our members who have the protections of a union and have strong organizations and the ability to take collective action and resources behind them, it's also a huge challenge for non-union workers in all of the industries that we all work in, as everybody knows. But as John Samuelson and others said earlier in the call, this is also, there's a silver lining. I don't want to say a silver lining, but it is creating new opportunities to organize, take collective action, and build power, and try to build a much stronger, broader, more militant base to push forward the kinds of public policy solutions that we're all in the process of developing and trying to push forward together. Just for our union and our coalition, it's created an opportunity where in the last 6 weeks, we've developed relationships with organizations in the immigrant rights community that we've never spoken with, that we've had no relationship with, and we are now like deeply embedded in their memberships and their networks. I'm really lucky that I work for a union whose elected leadership is very explicitly committed to continuing to invest time and resources and capacity in organizing and supporting these non-union workers in any way we can that are struggling to defend their health and safety on the job. And so, you know, those of us that work for unions that have this commitment, we're very lucky, and now more than ever, we need to be figuring out how to do it. But figuring it out and being flexible is really what we're trying to do. We're dealing with the challenges that everyone is talking about. How do we have Zoom calls that make sense in lieu of committee meetings? In one day, I'm going to like tell a very brief story that I think illustrates some of the opportunities and the struggles. We were invited to participate in a Facebook Live discussion hosted by an organization called Cosecha, a grassroots militant immigrant rights organization. They invited us to take part in a Facebook Live discussion to talk about warehouse workers' rights and organizing during COVID-19. And this was 4 weeks ago. Within 2 days of that call, I personally fielded more than 30 phone calls from non-union warehouse workers at one major warehouse with 800 workers. So on a Wednesday, we were on the Facebook Live call. We had never done any work with this organization. They posted our website and our phone number and our email. Over the next 2 days, we got more than 30 calls just from one work site. The Friday after this Wednesday night call, we had a Zoom call with about 20 non-union workers. The following Tuesday, we organized an action in front of this warehouse with a handful of very strong workers and and strong support from our union and other unions, other community allies. This was at a warehouse.
Sorry, you only have a minute left.
Great. No, that's fine. Through this, we've managed to win concrete changes at this warehouse. We've managed to start building a much broader base of workers, non-union warehouse workers at this warehouse and other non-union warehouses in the region that know workers at this warehouse, that live near workers at this warehouse, or just follow this organization or follow these protests on Facebook. And now we're figuring out, how do we keep folks connected? How do we keep building out this network? How are we building committees? And how are we using and developing a strong base to push for the kinds of structural reforms that we're all trying to envision right now? Because we know that we need fundamental change in all of these essential industries that we're working in. So we're trying to be flexible, we're trying new things, and we're trying to be as aggressive and as militant as possible right now to provide the support and some of the structure and really build our movement. It's a huge opportunity. We're working with a lot of different unions and other community organizations, and we're all trying to figure it out together. So I look forward to talking with everybody on this about how we do this.
Thank you, Dave. Very inspiring, all of you. Thank you so much. My colleague, Jeff Grabelski, has been monitoring questions from the last panel and this panel. So Jeff, I'm gonna see if you have questions from the chat room that you want to, from our participants that you want to ask the panelists.
Thank you, Kim. So there are a number of questions that have been raised from the first panel and from the second panel that I've tried to combine. I want to encourage participants to put additional questions in the chat box for another round of questions if we have time. I'm going to offer 3 questions for the panelists. They're quite different, and you should just pick which one you might want to respond to. They're actually very provocative and deep questions that can be seen through both an organizing lens and a policy lens. So one question is, how might we connect all of these various organizing efforts and fights that both panels have shared with us? How can we connect them in a way that is not just about these individual fights, but that's about a broader fight that raises fundamental questions about the common good that have been revealed through this crisis? Meaning, how do we address the need perhaps for public control over issues like healthcare or food supply chains or education, et cetera, et cetera. So question 1, how do we connect all of these fights to make a bigger fight for a better world? That's the first question. The second question is more specific, but it may speak to some policy issues. And that is, what can we do as a movement to help essential workers who've been on the front lines and have faced some significant psychological and emotional trauma from the work that they're doing? What is it that we can do coming out of this crisis to attend to those needs? And that question resonates with me just reflecting back on September 11th and the work that many of us did to deal with the post-traumatic experience of first responders after that disaster. So that's question number 2. How can we attend to the needs of frontline workers who have faced trauma? And the third question is, how might we use this moment to educate members politically about the failures of the Trump administration, both specifically in relation to the coronavirus crisis and more generally, failures in relation to the fundamental needs of working people in this country? Both generally, political education, and specifically to beat Trump in November. So 3 very different kinds of questions can be looked through both an organizing lens or a policy lens.
Okay, great. 3 different questions. Is there a panelist who'd like to jump in first?
I think I'm gonna jump into, and Joe, you can add, because we've been on these similar calls, but there was a, one of our union political directors and communication directors took a step and actually decided to convene a few of us to have a conversation about self-care and about mental health and some of the ways in which, labor could, be not just a kind of a convener of sorts, but a resource. A bunch of different players are at the table, including NYCOSH and the State Fed, the CLCs, and a few of our, the different consortiums and worker groups. But, one of the things that it's a change, right? A mindset change that, it's not just about the person as a worker, but as a, holistically as an individual, someone who is not just the teacher with the students, but the teacher at home teaching students with their children and their families, and then worrying about bigger crisis and financial, stability when you see big budget cuts. So, we're looking at self-care and anything having to do with mental health from the lens of not just the member, but of staff that are now coping with their members. I remember a few conference calls where I broke down and a few of our, strong, right? Some of our directors broke down, and it's just the stress of it all. And so, there is something in the works, and happy to engage going forward on that.
Okay, thank you.
Yeah, thanks, Lucia. Just on that, my comments earlier about the workers' compensation system, that's specific to New York. Every state has a different workers' comp system. If the traumas experienced at work, there's an opportunity for it to be covered by workers' comp. For union members, many of the union healthcare plans have coverage for mental health services. I also, it kind of going back to one of the things that Abdullah mentioned, I think is appropriate in response to maybe one of the other questions here, is this idea of austerity. We've tried austerity over and over and over again, and it doesn't work. And when you look at the last 100 years, really the only recovery plan that really has worked for workers was the New Deal. And there are a lot of complexities there, but very basically it was based on protections for workers and spending to support workers. Now, you had the Second World War and all of the spending that went into supporting that. But when it comes down to it, that spending would have supported capital only and not workers if it were not for some of the protections enacted in the 30s in response to the Great Depression. And this isn't to wax poetic about that time. There's certainly many bad things going on in the middle of the 20th century in this country. But one of the good things that was going on was the establishment of the middle class. If you contrast the recoveries of the past 40 years, seeming like once every 10 years, there's a bailout for business, no connection to workers or workers' rights, and instead of a recovery that lasts decades, we have recoveries that last 7 to 10 years and necessitate another infusion of cash for capital as opposed to working people.
Thank you. Abdullah or Dave, do you guys want to jump in here? Go ahead. Abdullah.
Yeah, I can speak. So I actually think that the first question, how do you connect organizing fights to build, united base? And the third question of how do we politically educate our members, our various bases, both generally and around Trump, are sort of entwined when it comes to answering them. I think political education is going to play a significant role in how we unite our bases. And that means that we need to create organizing opportunities to put our bases in closer contact with one another, because the bosses have been very happy to have us all be siloed, to only fight for our own. And we're realizing now that the universal demands around education, around housing, around food, around healthcare, and a jobs guarantee, these actually impact all of the working people, regardless of status, regardless of ethnicity, creed, whatever. And I think that's a message that we need to drill into our bases. And historically, I think the labor movement has been incredibly effective at trying to bridge that divide. But you find that on the advocacy side, particularly in the NGO space, due to the way foundations are structured, funding streams, relationships with power, and capital in general have made it so that it hasn't necessarily been in the best interest of advocates to lean into that, but rather instead lean into making sure that services are funded adequately. And that has ended up creating, it's been a very rational choice, and because you're addressing material needs, but it's really narrowed the focus. And I think this crisis is an opportunity for us to really undo a lot of that. And recently, before all of this really took all of our attention, I was particularly excited by E-Verify legislation that Senator Ramos had introduced in New York State. And that would undo, that would severely restrict the ability for employers in New York State to use E-Verify as a method to check in on their employees. And I think that piece of legislation in particular was a really cool opportunity for us to both build the unions and also educate our members. So I'm looking forward to continuing to work on legislation like that. And of course, you know, we have our annual May Day relationship in the immigration and the labor movement that we've developed here in New York. And, you know, it shouldn't be once a year. It should just be a constant ongoing process. I really loved what Dave said about his members coming into contact with COSECHA's members, and, you know, the outcome of that. I think there's so many opportunities for that, and we need to look year round to make those opportunities a reality.
That's awesome. Thank you so much. Dave, did you want to jump in?
Yeah, just real quick, speaking to the first question about connecting these fights to bigger fights for the common good and some big and maybe radical changes that we know we need. Just to echo what Abdullah said, showing, I think there's a question of our organizations need to demonstrate real leadership around this, but the only way that we're going to demonstrate leadership is we show real results. And so, you know, we've been intentional about discussing how we've actually been able to make huge progress in our campaign in the last 5-6 weeks by really diving in with organizations that we haven't worked with, and showing how connecting with workers, not just immediately on workplace issues, but, you know, really working with organizations that are on the front lines of the struggle for undocumented worker rights. I mean, it makes sense for organization, given who our members are, largely immigrants and other people of color, but really showing how the only way that we're going to build the base strong enough to win any of the workplace fights we know we want to win, the only way we're going to build that base is by connecting on these other issues, building broader coalitions, and really digging deep on these issues. If we want to organize a warehouse, warehouses are built like fortresses. They're in the middle of nowhere in a lot of instances on purpose. But warehouse workers live in dense, in a lot of places, dense immigrant communities where folks know each other, folks go to the same churches, folks are involved in similar civic and immigrant and other organizations. And we know that the only way that we're actually going to build committees and build power is by approaching this from those networks and not just running right at the workplace. And so I think that's how we're trying to think about it. But we don't have the answer yet, but we have to. I think we have to, and this is a crisis that shows that we have to do it now and in the next few months, because folks' lives are at stake and the future of the planet's at stake. So, but that's a very important question.
Absolutely. Thank you so much. And Abdullah mentioned that May 1st is a day we often come together, and it's coming up tomorrow. And I guess non-union workers perhaps get it better than some of us union folks. I hear there's going to be a national strike tomorrow of a lot of non-union workers and across Amazon and Instacart and you know, all of these different places where people are just rising up. So it's very exciting, and it definitely fits with the things that each of you have said. Jeff, I think we may have time for one more final question. Is there one last burning thing?
There is, in fact, one additional question that came in. I don't imagine that we have time to fully explore it, but the question is, this pandemic has revealed fundamental and underlying structural problems in how our society and economy is organized, whether it's in a fragile infrastructure, the racial and class inequities, the rising inequality, the problem of climate change, et cetera, et cetera. And going all the way back to what Judy said in her opening comments, and then what the panelists just said just now, we really can't imagine going back to the pre-pandemic reality, because that did not work for working people. And the question then is, how might we rethink organizing and building workers' power in a post-pandemic reality? And how might we reimagine reorganizing our society and economy so it's more fair, more just, and serves the needs of working people? Maybe that's a question that we just let float because it's a big one.
Maybe that's Lara gets to answer all those questions in her closing remarks. Are there any panelists who want to take one last closing comment about the big picture?
I would like to.
Judy wants to. Go ahead, Judy.
So I think, you know, this is an ocean that we never swam in, right? And after disasters, there's not just us, there's the other side. I mean, we're already getting pushback against workers' comp. We're being accused of, you know, let's not forget that there are other people out there that don't want this movement to be built, because I think that they recognize the incredible opportunities we have to build unity and to be creative and to really look at things in a very different way. And they don't want that to happen. So I think we just have to be really aware that we have a very small window of time whenever we get to COVID-2 or COVID-3 or whatever that phase, whatever those phases are. And we've already tried to educate our members to step outside of their own comfort zones and to step outside of their own shoes. And I think that all unions need to do that. The differences that we have are so minuscule. When we recognize, you know, the enormity of a crisis, this is the time to bring people together, to listen to one another, and to realize that there's, you know, we are the 99%. You know, there's this tiny little group of people that control our lives and what we share. And we've seen it. We've seen the way people come together to support one another. It's very powerful. It happens in disasters. The government fails us, the people rescue us. And that, taking that energy and that love and that care that we have for one another and building it into, you know, looking at the public good and all the things that are public good, energy, healthcare, all the things that really should be public goods. What do we do together as union brothers and sisters, as community members, as immigrants, as marginalized peoples? All of us have so much invested in one another. What are the things that we can do to really make that real? We have a short period of time, I think, before we kind of get taken over again. So I think that these conversations are a good start.
I appreciate that a lot. And unfortunately, we don't have a lot of time left, but I am going to just thank all the last set of panelists. You guys, thank you so much. All just brilliant comments, and I appreciate it. And thank you for all the critical work that you're doing. I am going to turn it over to the Worker Institute's Executive Director. Lara, you're going to get to try to pull this all together for us in our closing remarks about the lessons we're learning in the future. So I want to introduce Lara Skinner. Lara.
All right, thank you, Kim. Good afternoon, everyone. First, I just want to say thank you to all of the leaders and members of unions, worker organizations, and social justice organizations who joined us today. It was great to see you, and it was, you know, very powerful to hear about what you and your members and workers are going through. And just really impressive to hear your determination and commitment to protect members and fight for the fair treatment of workers during this global health pandemic and economic crisis. And clearly, as we heard, there's some really great, important work and innovative work that's being done. So, you know, thanks to all of you, great work. Second, I just want to, you know, echo, you know, what's sort of been highlighted a few times here is there's no doubt that we're in a major crisis, both a public health crisis and a growing unprecedented economic crisis. And like most crises, this one presents great peril and danger, as well as great hope and opportunity. And, you know, that's what we're hoping today's conversation does, is help us sort of crystallize what's that hope and opportunity and how do we act on it. And as Judy said, you know, act quickly, because we know that there's a limited window here. So on the one side, as many of you have pointed out, COVID-19 has dramatically shifted the public discourse and attention, and it's really spotlighted the critical role that transit workers, grocery store and food supply chain workers, delivery and warehouse workers, nurses, healthcare workers, and others play in our economy and society. And as Alice and Julian said, you know, COVID-19 has really exposed how our current political economic system is failing us. And it's exposed the extreme levels of inequality that currently exists in our society and the vulnerability of millions of workers. And so suddenly paid sick leave, unemployment benefits, the gig economy workers, freezing evictions and foreclosures, canceling student debt, they're on the table and they're woven together. And although these are temporary victories that include too few workers, like undocumented workers, it's pretty incredible that we're seeing these opportunities. The surge in worker organizing that's been mentioned is also very exciting. We've had more than 150 walkouts and strikes in the last several weeks. As Kim said, there's another one likely to happen tomorrow, driven largely by low-wage non-union workers. And this surge, you know, we have to keep in mind, comes on top of, you know, 2 years of really important labor activity that we've seen, right? Red for Ed, the GM strikes, the Stop and Shop strikes, among others. And then, you know, us also seeing public approval for unions rising to 64% recently. So there's the opportunity. And then on the other side, you know, we're facing incredible barriers to building a better, more fair, just, and democratic post-pandemic world. The last 2008 economic recession and then the ensuing austerity, it led to greater economic and racial inequality. as many of you have mentioned, included a major expansion of low-wage jobs and workers who lack basic workplace protections. And even with workers demanding more power and voice on the job, and there being a greater public appetite for workplace justice, as we're seeing right now, as you all know, it's way too hard for workers to organize in this country. And then, you know, it's important, I think, to remember that since the last economic crisis, the climate crisis has worsened and accelerated. And we know that climate change hurts working people first and worst. And so that kind of paints the picture of what we're up against. And so, you know, given this crisis and the great peril and opportunity it presents, we hope that today's conversation can help create space for and really sharpen our individual and collective thinking and vision for how best to take advantage of this moment to organize and fight for a better world. And as some of the speakers mentioned, we clearly see openings around paid sick leave, new healthcare, childcare, and elder care systems, tackling historic inequities around race, gender, and immigration status, combating climate change, which has contributed to this crisis, expanding fundamental worker protections, including the right to form a union to independent contractors and other gig economy workers, and then connecting this to the many new exciting organizing opportunities that we're seeing emerge. And, you know, I think, you know, we all see that this is a really tough period. As we've heard today, leaders of the labor and social justice movement are juggling a lot of balls, right? We're doing rapid emergency response work to protect frontline workers in life and death situations, supporting laid off workers. We're securing important worker protections in the stimulus and recovery funds, and then also trying to think about how to leverage this moment into lasting positive change and power and voice for working people. So with that, on behalf of the Cornell ILR School, the Worker Institute, and our New York State AFL-CIO Cornell Union Leadership Institute, I want to give a big thanks to our speakers for contributing to today's discussion and all of you who joined the conversation. We at the Worker Institute are really proud to work with our partners to convene conversations like this. We hope to do more. We think that this allows an important exchange of experience, strategy, and vision to protect workers during this crisis, advance workers' rights and collective representation, and ultimately build a more powerful, inclusive, and diverse movement coming out of this pandemic. So thank you for joining today's conversation. We really appreciate it. It was nice to see you all. Thanks to our amazing Cornell and Worker Institute teams for making this conversation happen. And we're sending much love and solidarity from the Worker Institute to all of you for your safety and health and a much more just future ahead. So thank you.
Thank you.
Thank you, everybody.
Thank you, everybody.
Thank you, everyone.
Thank you, everyone. Thank you.
Thank you.
Good to
Thank
see
you.
you.
Thank you.